हाँ जी पीडो सो मैं की सीखिया यूट्यूब और भी एडवाइस 80% है पेशेंट मैनेजमेंट वो कई क्लिनिक जनरल सडेशन करते ही नहीं करके पेशेंट मैनेज कर लेंगे सो यू हैव टू डू द काउंट डाउन मैथड 3 2 1 थोड़े जोश ना बच्चे को कहना पैंदा कि मैं हुण करना ही राइट then sometimes you have to parents ਦੇ ਵਿੱਚ ਇਨਵੋਲਵ ਹੈ you have to send them outside too ਨਾ ਤਾਂ ਜਿਹੜੀ ਸੈਟਅਪ ਆ ਉਹ ਔਖਾ ਆ ਹਰੇਕ ਬਿਜ਼ਨਸ ਸੈਟਅਪ ਤਾਂ ਜਿਹੜੇ EMPLOYEE ਤੁਹਾਡੇ ਵਧੀਆ ਆ ਕੰਮ ਕਰਦੇ ਆ then it's not a big problem depends on your employees really you don't want lazy you want active lousy lazy no you want them to be fast so ਕੀ ਕਰਦੇ ਆ ਕਈ ਵੱਡੇ 5 ਕਾਲਮ ਰੱਖਦੇ ਆ so ਪਹਿਲਾ ਕਾਲਮ every hour treatment है ना 8 का treatment यही हो गए start कर ले 8 का treatment सीधे यही हो गए right then after that you know the red tier columns are exams and एक कोई हुंदा exam करने वाले है ना so की distal shoe हुंदा है ता okay ortho दा थोड़ा जिहा हुंदा medial step distal step ता edge to edge है ना और तुसी छोटे बच्चे दी ऑर्थो वाली देखी नहीं होंदी ऑर्थोडोंटिक 7 years which you send them at that time what you're trying to see is figure out if they have class 1 class 2 or class 3 right okay anterior no space maintenance done there's no space loss there so done yeah it's fine you don't have to worry about it no space loss it's fine it's behind the it's the space maintainers 99% or just the premolars जिथे आ रहे हैं दोनों है ना and so these big fishes they do a lot of marketing calling seat the patient get the patient next this that ultimately the dentist the kid remembers the dentist so if they come for you basically so you're like a representative of the clinic so you have to be really good to the kid so they remember and it's not a big thing right so pedo is patient management right and to get $10,000 a day your patient किथों ले आने इन्हें you have to be in a crowded area जहाँ जिथे बहुत demand है जिथे कोई और pediatric dentist है ही नहीं उस area च right जिथे हों जिथे कई Sacramento जहाँ some places there's a lot of pediatric dentists basically you have to get a map right and figure out where there's no pedo in that area that no one does pedo handles the obnoxious kids right so can the maqsad GP tai cut their pedo because they don't want to deal with that stupid kid right so or the uncompliant kid so basically your pedo will work just got to open it in a place where there's no other pediatric dentists around there there's the demand I mean there's definitely more human beings than pediatric dentists right so I don't know Crothers Avenal Huron Kalinga you know those might be the places where you want to have just one day a week pedo right Porterville see that's why Lindsay either छोटे जिथे Hanford हो गया or Selma actually would be really good for a pedo because there's nobody around there pedo you know yeah boss so you know when you're 20 years into the career you don't want to switch gears now you needed to do that with 20 years back when you're fresh out of dental school you know now doing a career change is not worth it really